Let's talk about belly breathing, or what they call diaphragmatic breathing. A lot of clinicians, a lot of trainers, practitioners are teaching their clients or patients to breathe more from their belly, less from their chest. Because usually when we breathe from our chest too much, it's a thinking that creates a lot of strain in their neck, shoulder area. So they usually teach people to do the belly breathing exercise lying on their back with one hand on the belly, one hand on the chest, and when they take a breath in, have more movement from the belly with their belly hand rising more than the chest. That's great for the beginning to create some kind of awareness of what they're really trying to do is to create awareness of expanding their rib cage more outwardly, laterally, or what I call horizontally, because there's normally supposed to be that lateral or horizontal expansion as well as vertical expansion. Okay? The diaphragm works more when we breathe more outwardly, let's say. So here's the problem though. You have people too long on a program to lie on their back to breathe from their belly. They forget that you're supposed to breathe from your chest to some degree. Okay, so they start to be a little bit too extreme, and you have these people that are breathing nicely from the belly, they have nothing from up here. But ironically, although what they teach that exercise for is to take stress off the neck, ironically, like anything in life, it's actually creating more stress in their neck in the long term. So there's two things I have issues with that exercise if you don't further refine it or progress or follow up with your clients if you're going to teach the belly breathing exercise. One is we're supposed to expand outwardly and vertically, okay? So when you have somebody breathing from their belly lying down, if they don't expand from their chest, over time, that's going to promote not getting much expansion or air into the upper lobes of your lung. So the nervous system isn't stupid. What it's going to do when you start exerting yourself through more strenuous activities, it's going to get expansion vertically of the upper lobes of your lungs or rib cage by activating a lot of muscles that insert from the upper rib cage to the neck. Scalenes, SCMs, etc. So they start breathing more like this. But meanwhile, they have great belly expansion. Their belly's coming in and out, which is, they're doing that right, but they still have neck issues later on down the line. And I'm only saying this because I see a lot of patients and clients who've been to those people and still have problems. And then when I assess their breathing, they're excellent lying on their back, but they have no expansion. They don't know how to. They've fell into the dogma of it's bad to breathe from the chest. Two, when you're lying down, what's being supported? Where is all your weight? It's on your back. So your rib cage can't really expand posteriorly. It expands anteriorly in the front. So although they're getting more of a lateral expansion, it's still a little bit more imbalanced where it's coming forward. Now you take that same patient, put them upright, and they integrate what they just learned of expanding their rib cage, they're going to really focus on expanding forward like this, which in upright, it causes them to extend more. And then their front rib cage starts to flare out like this when they breathe from their belly, because they're doing it right? But what happens is when that ribs flare out, it brings the diaphragm in a length or position where it works less as a respiratory inhalation muscle, more as a postural stabilizer muscle, which brings the spine into more extension, okay? Which is what we call an inhalation position. So it limits their ability to expand outwardly, especially posteriorly. So it creates, ironically, more stress in their neck because the nervous system wants to breathe as fully as it can, so it starts to expand, open up these upper ribs more vertically because it can't expand more horizontally. So thus stress in the neck. Okay, so what probably would help or be more improved to progress the technique of belly breathing, which I like to really call just more horizontal expansion breathing or awareness of horizontal expansion, is to get the person on all fours so that frees up their rib cage in a 360-degree perspective. Get them into more thoracic flexion, which allows those ribs to expand more horizontally and especially more posteriorly. and then have them breathe along with their abdominals and their serratus anterior muscles to create more protraction of the scapula, more thoracic flexion, allows those ribs to open up more posteriorly. Then from there, from all fours, I would have them be more upright, more supported, whether leaning, the hands leaning on the table or leaning against the wall, like the old push up with a plus serratus anterior exercise we used to teach, where they're pushing their heels and their hands more by the piriformis, which is, not piriformis, sorry, pisiform, by the base of the pinky side of the hand. You push into that area as they protract their shoulders, flex their thoracic spine. Take a breath in, have them feel their ribs translate or lean back more posteriorly with the inhalation. Have them keep that position as they exhale, feeling their ribs being pulled down and in by their abdominal muscles. So they're inflaring their front ribs while they're pushing in the wall. So anyway, those are just two quick ways to progress the exercises. And if you're going to teach somebody and be a little dogmatic about corrective exercise or this is the right way of doing things, you better, or not better, but it might be more beneficial if you learn how to integrate or progress that exercise so that they don't become very rigid or limited in their perspective of what they're supposed to be, not supposed to be doing, or what's another way of doing it that may be more beneficial. So anyway, have a great day.